Real hustle, real people, real results.
What's up, everybody? Welcome to Real Hustle Podcast. My name is Chris Kiblin, and I will be your host. Today, we have a very special guest, probably one of the best chiropractors in the Sarasota marketplace. But before we get started, I want to talk a little bit about the show. Basically, we bring in successful entrepreneurs who talk about their business, give us some success stories, also talk a little bit about their failures so you guys can learn from that. Also, please check us out at realhustle.com. You can see our videos there from the podcast. But one of the biggest ways that you can support us is by going over to our gear section and checking out our hats, our hoodies, and help purchasing those because that helps pay for these podcasts as well. All right, let's get started. Today we're here with one of my good friends, Andrew Wengert from, where are you from?
I gotta look My office is Veracity Soft Tissue and Spine.
Okay. And so you're a chiropractor, correct? Yep. But you're not a normal chiropractor. One of the things I love about you. So why don't you tell us a little bit about that?
Yeah, so we do things a little bit differently. Most people, when they think of going to the chiropractor, they think of getting their back cracked or adjusted, whatever word you want to use. We do that, but it's a small percentage of what we do, not because we do a different thing, but we just have found something else that tends to get better results. We do a lot of soft tissue work, working on muscles, so we're always looking at how things move. Does a person have good range of motion? Do they have good strength? So we really focus on a lot of soft tissue work, breaking down adhesions, making sure things are moving well, and then making sure the person is strong enough to actually do the tasks that are asked of them in everyday life.
Okay, so let's kind of one of the things I always like to get backstories.
Oh yeah, absolutely.
So let's backtrack a little bit.
Okay.
So first, how did you decide that you wanted to get into doing this as a business?
Okay.
And then kind of also explain that, but then also decide why you took a different approach in this business.
I mean, to do that, I guess I have to go kind of way back, right?
Okay.
So I'm originally from upstate New York, Utica, which is between Syracuse and Albany, right in the dead center of New York State. And baseball was like my thing. Always played baseball all day, every day. And I ended up getting a scholarship to the University of Buffalo. Played baseball there, made some good friends there, but also realized very quickly that I was not going to be a professional baseball player. And I had to figure something else out. I liked exercising and working out, so my degree what I pursued was an exercise science degree. Got that degree, became certified as a strength and conditioning specialist, but sort of realized in upstate New York there wasn't a huge personal training market it's not all about money, but it didn't really pay well up there at the time. And someone came and spoke from New York Chiropractic College, which was the college I ended up going to, just about chiropractic. And I kind of liked everything. You know, it was anti-surgery, anti-medication, more getting to the root problem. So it interested me. I went and looked into it more, visited the college, talked to a couple guys that I had played baseball with at Buffalo, actually went to that school. So I had some connections there already. And I ended up enrolling there at New York Chiropractic College. So that got me into chiropractic, the profession. So graduated there, got a great education, did well. The only hang-up was it was still always about just the manipulation was the main source of treatment with that. And me having
is that like the old school?
I don't want to say yes, it is old school, but it still has a place. It's just not, there are other things that you can get better results, longer lasting results for patients with other than just the manipulation. But I didn't know that at the time. So I graduated, got out of school, moved down to Florida. My wife is a physical therapist. She had a job down here already that was set up. So I was kind of living off her in the beginning, just trying to set things up. I was getting after it, just doing all sorts of silly stuff. I would walk in anywhere I could, just hand out business cards. I was fresh out of school. I had no idea what I was doing. I mean, I was down in South Sarasota, like I'm 25 minutes away from where my office is, just handing out cards at like GNCs and just random places. Actually rented a table at the Red Barn Flea Market. Just just passing out, just talking to anybody that wanted to talk about their pains. But that grinding away at it helped. Like you learn something even with your kind of failures with trying to build your business. You learn a lot about like what works, what doesn't. Every interaction, if you pay attention, you can learn something from, like, just in talking to people. So I was doing okay. I started my own little practice. I was renting space from someone else, getting some new patients in, but it was slow. It was a slow growth. But the guys that I was renting space from, like, you're doing great. You're doing better than everyone else we've had. But then I was still kind of looking for jobs. The idea of working for someone else was still there, and I got a job opportunity that I saw, and it promoted itself as, work alongside medical doctors, neurosurgeons, physical therapists, massage therapists. And I was like, this sounds pretty good. So I get there, and I quickly learned that everyone that I saw was an auto accident case. So I was in an auto accident mill, just treating people.
Oh, wow.
I wasn't asked to do anything illegal, but it was just not fulfilling work. These people, right. There was a financial incentive for them to not be better. So it just kind of took the...
Didn't feel kosher.
It didn't. It's just, people would get better, and then they'd be like, oh, my attorney told me to come back or whatever. And you're just like, okay, this is the game. Whatever. It is what it is. So I did that for, I don't know, probably 3 years, like just doing that. It was okay. I learned a lot. I got a lot of experience. I got comfortable treating patients, I guess, more on the professional side of it that you don't get in school. And then I was always a gym guy, so always worked out, and guys at the gym would be like, you're a chiropractor, can I come see you? And I was always like, no, like I just do auto accidents. But then I thought to myself, like, why can't I help this guy out? Like, with some of my closer friends. And I was like, I can. So I talked to the people that I was renting space from, or the guys that I was working for at the auto place, and they were like, yeah, it's fine as long as you're not treating auto accidents. Like, go for it.
Right.
Have at it. So I got my own malpractice insurance, started my own, rented space from some other chiropractor that had a nicer office than the first spot I was, and would just give them a percentage of what I collected from every visit. Built that up, got busier, but I was still doing the auto accident thing like 9 to 5, and then I would do my own separate thing from, 6 to 8:30 or 9 or whatever.
So you were hustling.
Like, honestly, I look at it and like, it seems ridiculous now. Like, I would get up, go to the gym, 5 a.m., get my workout in, go work this 8 to 6, 8 to 5, 9 to 6, whatever it was, get done there, go visit one CrossFit gym, explain what I was doing, what I did. I would treat 3 or 4 people there, go to another one the next day. Like, I had my own schedule. Like, I'd be at different gyms, different days, and was able to actually build up enough that I went and talked to my auto accident place, and I was like, hey, can I drop down to 4 days a week? And they were fine with it. And then I eventually dropped down to 3 days a week, dropped down to 2, and then totally cut ties with them. The only regret I have is not doing it sooner, like looking back at it. Because for me, one of my struggles is that I like comfort. Like, I didn't want to ever take that big step. Like, I didn't want to totally cut the cord.
It's hard.
It is. And like, doing it then, I look back at it and it was like, it wasn't a big deal. Like, we didn't have kids. We didn't have any, like, a huge mortgage payment or anything. But like, having kids would make it even scarier now. But I mean, I tell people now, like, just do it. Like, if you put in the work, you will get the reward of it.
And that's what I love about this show. And that's why, like, this is a big reason I do this show, is because, see, you hear people like you and some of the past guests that we had, and sometimes we get very comfortable with what we do,
yep.
right? And we get very comfortable on how we handle things and how we just go through life.
Yep.
And we have these ambitions, we have these desires, and we want to do something more.
Yep.
But we're comfortable.
Yep.
We don't want to go.
Yep.
We don't want to get out of our comfort zone. And the thing is I love when we have people come on and they talk about how they were in their comfort zone and they get out of their comfort zone, because that's how you grow and that's
yep.
how you take that next level. Sometimes people don't trust the process or don't
mm-hmm.
trust themselves.
Yep.
And so one of the things that's great is hearing what you're saying, right, and talking about what you've gone through, and you got to that point. You're just like, I just did it,
yep.
right? And then now, I mean, I'm gonna have you talk about a little bit more about the success that you're having and the people
yeah.
that you're treating.
Yeah.
I mean, that's pretty awesome. And
yeah.
so, all right, finish going on.
So, I mean, I guess I could even bring it to a point now where I'm at a point now where things are good. Like, financially, things are good. The business is growing. We're doing well, but I almost feel myself getting into another comfort spot. Like, for me, it's like, okay, I know what the next step has to be, but how do I get to that? Like, how do I make that happen and do it? And again, like I said, things are good. But you always crave a little bit more. You don't want to get like complacent with things. But to take a step back, because your original question was, how did I get into doing things a little bit differently? So I had a friend, the guy that originally not got me into chiropractic school, but the one that told me about it. At the time, I was treating people, and I was just doing pretty much adjustments, like a couple modalities, some ice and e-stim and that kind of stuff. But I was talking to him like, look, these people are like, they're getting better short term, but the relief isn't lasting, right? So he at the time was working for the Buffalo Bills. They were paying him a boatload of money to go treat these, $1 million athletes all day long. And he was like, you got to get a soft tissue technique. You got to do something. So I looked into it, and there were a couple different ones, and he recommended this thing called Integrative Diagnosis, which was, it kind of combined the best of chiropractic, physical therapy, if you're familiar with soft tissue techniques, like an ART and a Graston, and it gave you like a whole diagnostic process to do. So for him, someone who's having that much success, has been certified in every soft tissue thing imaginable, is like, go do this integrative diagnosis stuff. I was like, okay, I'll do it. So I talked to my wife at the time, or not at the time. At the time, I talked to my wife when we didn't have a ton of, extra money laying around, and I'm like, I need to sign up for this $15 or $1,500 online course. And she's like, what? why are we spending $1,500 on this? And then I need to go to this $1,200 seminar to get certified in one body region. So that was a conversation we had, and she was on board with it. She's been very supportive of everything, up to this point. So I started doing the soft tissue stuff, and just it blew my mind. Like, I went to the seminar, everything, it just makes sense. Like, a lot of, whatever profession you want to, if you want to do physical therapy, massage, chiropractic especially, everything is just very belief. Like, you believe that this is what's going to fix the patient versus like actually looking at the patient. What is their problem? What are their limitations? What can you actually help with, or can you even help with this? And that's one of the biggest things that I found as a provider is, like, as I get better, there are more people that I'm just like, this isn't the case for me. Like, you need to go see the surgeon, or you need to, you need physical therapy, or you would be better suited with, for a lot of people, there are psychological things, like you need to go talk to somebody about it. This is not a musculoskeletal problem. And as I get better and better, I find that I'm not kicking people out, but like referring them out to other providers.
Because I know, like, I know when we because like, since you're my chiropractor,
yeah.
so like, and that's one of the things that I find fascinating is, like, you actually will be like, and I know we've had conversations about this, is like, no, you need to go see a doctor, or you need to go do this, and because of the fact of, like, I can't treat you, and I think that's a little bit different than maybe most people out there, is like, they'll just keep treating them because they want the revenue.
Yeah, and that's like that's the reputation chiropractor. Everyone says, once you go one time, you got to keep going for the rest of your life, right. Which is a great business model, but like from a fulfillment standpoint, like, I don't get excited for somebody that I'm going to see like once a week for the rest of my life. I get excited for the person that saw 6 other providers and they're better in 3 weeks, and they've had a problem for 6 years. Like, that's awesome to me.
You're seeing the end result, right? So you're helping them get to the point that they can actually see some, like, because like you said, a lot of people are like, oh, I'm going to have to go to the chiropractor the rest of my life. But you're actually helping people say, there's actually a light at the end of the tunnel, and I'm actually going to get better, and I don't have to keep doing this forever. Some of the stuff that, like, I've seen, just the stuff that you do with me, and I've been to other chiropractors, and it's like, I leave your office and I'm like, God, I feel so much better, because it's a different type, and it really does work. And it's like, and you take the time to figure out what's the problem is. And that's what I like about it. And that's what I think is different about you. And so I know, like, and so you've built your business, and you've actually built it quite well, because I know that you have some other high-profile clients. So tell us a little bit about that, because how did you get to that point? Is that from the gym, or is that, or how did you get to that point?
So, there's a bunch of different... So I've had different clients. I've had some professional athletes. I've had some big bodybuilding people, and each one is kind of a different story, but it all comes down to kind of establishing value. So with most of the athletes I've had, I have gotten in that way, or gotten to treat those people by getting their coaches to understand and trust what I do. Because, you can walk up to anyone that works with pro athletes and be like, hey, I do this or that. But like, they need to kind of experience it for themselves and like to hear pitch sounds bad, but it is a pitch, like what you do and just an explanation. So for more of like the athletes, that was something. I know there's some people, I'm big into fitness and working out, so I reach out to influencers in like the bodybuilding fitness world. And I've gotten to them. Some of them I just DM'd. I had one girl that she showed a picture of a squat that she was doing, and I sent her a DM on Instagram, and I was like, hey, you've got this going on when you squat. Do you ever get pain over your SI joint? And she sent me a DM back. She's like, yeah, absolutely, all the time. Like, I've had numerous injections for that, and they just keep recommending more injections. And I'm like, if you ever want to get that looked at, come down. And like, she totally bought into that. She drove an hour down a whole bunch of times for treatment, and she did really well. And that was really cool because she has a huge following, and she promoted our business and what we do. So it worked really, it works out really well for everyone. Especially when you get people who have seen, like, she's someone that's seen everyone under the sun, provider-wise and treatment-wise, and done everything. And when you can fix those people, like, that's huge. Right. That's what it's all about.
I know, especially so, because, I'm into bodybuilding, my wife's into bodybuilding.
Yep.
And so, like, that, we put a lot of pressure and a lot of stress on our bodies when we do our workouts. And so, like, and it's tough because, like, and you hear, like, you need massages, you need to go see a chiropractor because, like, just to help realign you.
Yeah.
And so, and I can tell you, I hate it.
Yeah.
Hated being cracked.
Yep.
I hated it.
Yep.
I had a guy that was before you, probably before I started seeing you, about 6 months ago, and he would crack my neck.
Yeah.
And every time I'd freak out.
Yeah.
It freaked me out. And I'm like, I don't like it. Felt good because it like relieved the pressure for a little bit.
Yeah.
But like, it was like, and then I told Debbie, I was like, I can't do this anymore.
Yeah.
I was like, I've had enough. I was like, I don't even want to go back.
Yeah.
Like, it's just something about it. And so, like, that's when we, and I heard about what you did.
Yeah.
And I told her, I was like, yeah, but, and I was telling her, because, like, I forgot who I was talking to. It was somebody at the gym that told me about you.
Yeah.
And so, and it said how you do it differently. And I was telling him, I was like, we got to go see him.
Yeah.
I was like, because we need to make an appointment. Because that sounds more what we need.
Yeah.
And I guess we've been seeing you probably about a year now.
Yeah.
And so, like, and it's made tremendous difference in both of us. We talk about it all the time.
Yeah.
And it's like, just because of how you treat is just a different way.
It is. Yeah, for sure. And I think the thing that's cool about you guys is you guys have, like, upped the load that you're putting through your body, and you're maintaining well with it. Like, yes, you still need to come in to get things worked on, but, like, you're loading up more. You're training harder and more than you ever have. Same thing with Debbie. Like, and that's like, a lot of the problems with healthcare is, you'll go to physical therapy for 6 weeks or whatever, and they'll be like, okay, well, running hurts. Well, stop running for 6 weeks. And you're like, oh, yeah, I'm better. I haven't run in 6 weeks. But then they go back to running, and the problem's right back there. Like, when you can keep people in the gym working out and training hard and have them actually get better, like, that's cool. Like, that's what healthcare should be,
right? Versus
just like, oh, stop golfing for a month,
right?
And
you'll be
back
fine.
Feels better,
right?
And then the second you go back to playing, it bothers you.
Then you can't enjoy what you love.
Exactly, and that's what it is for that. They're literally, like, from a marketing standpoint, for me, it's like that is the thing that hits people. Like, whatever it is, whatever your thing is that you can't do. And I've read different, like, marketing books on this. Like, you've got to hit that pain point for people. Like, it's not, they talk about, like, wanting to be able to pick up your kids or look better in a bathing suit, and you can't work out. Like, you've got to hit those pain points for people. It's not oh, my back hurts, like. And that's
right.
That's the thing with it.
Well, that's the thing is, like, so I know, like, because there's, like, golf people I know, like, they can't play golf. They had to stop playing golf, right? But they love playing golf. That's their thing. So, like, and it's tough because you're taking away something that they're very passionate about, and now they can't do it anymore. And their self-esteem is going way down, but you're giving that back to them.
Yeah, I mean, you're taking away all that social interaction with your friends. I mean, I know just from the way my parents are with the way COVID has been this year, like that's their
Right.
That's their social group, and weren't happy this year that they couldn't interact with their social group like everyone else was. But yeah, that's the big thing for. Especially, that's what I've noticed with golfers. Like that is and same thing with gym people.
Oh,
like
it's
CrossFitters,
huge.
like you get a CrossFitter that like can't go and work out the way that they want to. Yes, they love working out and they like the results of working out, but I mean, that's a social group too. Those are all your friends. You guys go through the same, trials every day trying to test yourself, and you lose that. That's what gets people.
So let me ask you this. How'd you come up with the name, the business name?
So it's actually a pretty cool story. My sister-in-law works for, if I mess this up, she's going to kill me. I always mess up Bath and Body
Hopefully
Works.
she's not
and
listening.
Bath and Beyond, but she works for Bath and Body Works. She's got a graphic design degree, big into like marketing and branding. And she basically gave me a homework assignment, which was figure out like what you want your business to be. And like this took weeks. Like she kept giving me all these different, like there were different steps in the process. And the thing I wanted to kind of establish is like that we're based in like reality. Like this isn't hocus pocus chiropractic stuff.
Right.
And it's all about facts and measurable numbers and data. So the word that kind of popped up after all these things was veracity, and which means conformity to facts or accuracy. So I thought it just worked out really well. And she did the logo, which is an iceberg. Which is, with the iceberg, you see the tip of it, but it's all about that deep stuff that is actually what makes the difference. So, I mean, she did an excellent job with it. She actually told me that when she applied for the job she has now at Bath and Body Works, that they kept coming back to the website she did for me and the logo and everything, just because they were like, "This is really cool how you did this and the colors." But she did an awesome job with it. But she like put me. It was an assignment for me. Like I had to work. She gave me a lot of stuff to do to figure it out. But it's worked out well.
Cool. No,
yeah.
So the iceberg thing is pretty awesome because that's true.
Yeah.
I mean, we talk about that even in business, right?
Oh yeah.
So all the stuff that a lot of people don't see, they only see the tip part of not everything that you're going through, the grinding, the hustling, the late hours, the working.
Exactly.
You're working 2 jobs and stuff like that. So that's pretty awesome.
Yeah, we post the social media videos of like, me treating someone's neck. It's like you have no idea how much goes into being ready to actually figure out that spot on their neck is what they need treated. Like there's so many things versus just the tip of the iceberg, so to speak.
So what's the biggest issue that you see coming in the door? So what's
back pain by a landslide.
Back pain
all day long. The thing that's tough about when people have back pain, it is so intense. Like with my population, tends to be, I don't know, 20 to 55. It's if you schedule an appointment and you're in that age range, I can almost guarantee it's a disc injury. And when discs tear, just the pain from that, if you've ever had one, I've had them, it's incapacitating. Like you can't stand up straight, you can't bend over, you're kind of stuck. By a landslide. Because for someone to come to your office, the problem has to be bad enough that they know they need help for it.
They need treatment.
And, most people will go through life dealing, especially people that work out, like you've always got something going on. Something's always bothering you. But it goes away on its own until it doesn't. Yeah. But like back pain is in another category. Like when those discs are bad and you can't sit and you can't move, like then you're like, okay, I'm going to schedule an appointment. So
cool.
Backs by a landslide.
So, all right. So let's give the viewers a little something. Give us like success. Give us something that you learned along the way that was successful, that you can help with somebody, and also give us a failure that you learned about. So let's talk about a success that you got, like some
more
success.
in like a clinical standpoint, or just like a business standpoint.
Business part, right? Let's talk because this is like we're talking
business,
about business. Yeah. So let's
absolutely.
give them a business one.
So business one, the biggest thing for me is just focusing on providing more value to people. Like always, I tried to do some stuff early with like Facebook, and this isn't a knock on Facebook marketing, but like, it's like, okay, get more people, do Facebook marketing or do Google AdWords or whatever your thing is. And it's like, for me, it always comes down to just, you have to fix people. Like you have to get people better. Word of mouth is huge. And you can use those other outlets to, use testimonials to kind of spread that word of mouth, but don't ever put more into marketing the sauce than you do to making the sauce. Does that kind of make sense?
Absolutely. Like it's basically you're trying to build a relationship or more
100%
about that, right? So like it's about putting the value into the person you're trying to help. That adds the extra value, like doing that kind of stuff. But really, it's more in maybe the grassroots of it, of that particular taking care of your client.
Oh, 100%.
So then that makes sense.
Yeah.
So what about what kind of obstacle? Give me an obstacle that you came across and that you had to overcome.
I think we kind of touched on it a little bit before, just being too concerned with being comfortable. And like I said, I'm kind of going through it right now. Like, we're not at capacity, but like I'm looking, it's always like, okay, well, what's the next step?
That's what I was going to ask you. What's your next step?
And like ideally where I would like to take things, and a couple other guys that do what I do, there's a few of us scattered throughout the country. Like the step that we've kind of figured out is like, it's very hard. Like what we do is very much a skill, and it's hard to get somebody trained up in the whole body. But like if I could bring someone on that would do it almost like the orthopedic surgeons do. Like you've got your guy that just does low backs all day. Because like where I am now, I'm treating wrists, I'm treating elbows, shoulders, like anything on the body other than like a TMJ thing, I'm doing it. But if I could, like, how do you grow and build a business would be to bring someone in, and you could get them trained up pretty quickly if they were just doing necks all day or low backs all day versus trying to bring in someone else and have them do everything.
Right.
So that's the step that I know I need to take at some point.
Because that's the other thing, because you hit on it for a second. There's only a handful of you, right?
There are.
There's
going to be less because the guy that's did all the training for it is actually looking into opening his own clinic and then like franchising or kind of growing his own brand out of it, getting people to either buy into his thing or so like the training for it. There's a very short window of that. So the training they would get would have to come from me versus the person that trained me and all the other guys that do it.
How many are out there that do what you do?
There's maybe 60 to 100 maybe.
In the whole country?
In the world.
In the world?
Yeah. Holy crap. We get guys from, there's some Canadians and some Australians. It's not.
But that's crazy to think that there's only that few of people that do what you do.
Yeah.
I mean, and the type of what you do. I mean, that's what I found. I mean, because that was the thing, is one of the things that attracted us coming to you. Is because of what you do, and you just don't see it.
No.
And it's just something completely different. And it's a completely different process, and I think and that's kind of cool, right? Because we're having you on this and getting the word out. It's like, because I don't think a lot of people realize what you do is such a difference, because so many people just hear the same thing with a chiropractor. Oh, I got to go get cracked, or I got to get put on that machine where they push me up and down 10 times. You know what I mean? So it's like, and that's the thing. So that's why I think this is kind of cool. So, all right. So for those that don't know, I'm going to give us a little bit of a personal story about us.
Yeah.
So you and I, we both work out at the gym, and see you up there quite a bit.
Yep.
And it's become a kind of a laughing thing with us every time we see each other now. So for those that are listening, you need to go to realhustle.com, watch our video, because we actually have this thing where we go into the gym, and every time I see Andrew, he's always got his hat backwards. So I brought a hat for him because I'm going to give him my Real Hustle hat so that way you guys can see it. But the thing is, it's become a joke now. And one of the things that's really, I think it's kind of funny is when I see you now, it's like, we talk about, because like you can't get your gains unless your hat's backwards. So, so check us out on realhustle.com and check out the hats. But like, it's just like, it's actually quite comical now. So what made, because you've been doing that for a while. So any particular reason?
What, wearing the hat backwards?
Yeah.
I just, I think it was, was it Over the Top with Stallone where he turns the hat
backwards?
And he's like, once the hat turns back. I don't remember the exact line.
Was that the arm wrestling one?
Yeah.
Yeah, the arm wrestling movie, right? That he did, where he like turns it back, and once he turns it back, he actually is like, now he's like a different person.
Different person when the hat turns around. Yeah.
So it's been kind of funny. So I was like, I have to bring you a hat.
Yeah.
I was like,
that's awesome, man. I appreciate it.
So anything else you want to share with us? Anything else that you feel like you want to let the audience know about?
I mean, I would just kind of recap, like, I know this is kind of a I'll do it two ways, I guess. From a business side, like, and I don't think you're going to talk to anybody that loves being uncomfortable, but just everyone's uncomfortable with whatever your next step is in your business. So just try to get comfortable with the uncomfortable and take that step. I mean, don't be reckless, but but be like, have a plan to take that next step and do that. And then from just a like a healthcare provider side, like if you are dealing with anything, like be an advocate for yourself. If the treatment you're getting doesn't feel legit or doesn't feel right, you know, if you've tried 5 different providers, try a 6th one, try something different, because the current state of healthcare, especially the insurance system, does not reward excellence. So you have to push your doctors, and you have to push for better doctors, because we see so many people that just get chewed up and spit out by the current healthcare system. Like, you just be an advocate for yourself, because I don't care how great your doctor is, nobody's going to be a bigger advocate for yourself than you are. So. Cool.
I appreciate you being here. So how can people get a hold of you? Where can they find you?
So we're online at veracitysts.com. Instagram is veracity_soft_tissue_and_spine. I had to think about that. And then we have a Facebook page too, Veracity Soft Tissue and Spine.
Okay. Yeah. I appreciate you being here. Thank you for taking the time. I think we got a lot of great information out there. So, All right, guys, until next week, I will talk to you soon.